You're watching Fox 45 Morning News. All local, all morning.
Well, it has already been a rough flu season, and we are just getting to its peak. Just ahead, there is some simple advice to keep yourself from getting sick. You are watching Fox 45 Morning News Weekends. Many people across the country have already felt the effects of this year's flu, and we're just getting into the peak of flu season. Joining us this morning is Dr. Ron Elfenbein from Chesapeake ERgent Care. He has a few tips especially important for parents out there. So this season seems worse than normal, is it?
Good morning. You know, I'm not sure it's worse from an actual number standpoint, but certainly from a virulence standpoint, from the people that they're sicker than normal that we're seeing. So we're seeing really two variants. We're seeing the typical flu, upper respiratory type thing, you know, high fever, body aches, feeling pretty badly. And then we're seeing a GI version that's nausea, vomiting, and diarrhea. And they're both pretty awful and making people really, really sick and feel really, really bad.
Okay, we're just getting into the peak of the season,
yes.
So expecting...
Getting worse.
Okay.
Worse by the day.
Okay, and then treatment options. When do you decide to go to the doctor? When do you decide I can tough it out?
So it depends on kind of what you have. So we determine whether you have influenza by a nasal swab. We swab your nose and we get the results back in about 5 minutes telling you whether you have actual influenza or not.
Okay.
If you have influenza, we can give you an antiviral medicine. You may have heard of Tamiflu. That's one of the ones we can give you.
Okay.
And that will shorten the duration of your symptoms by about 12 to 24 hours. Doesn't make you feel better, doesn't make you get better fast. Well, it shortens the duration of symptoms.
Okay.
If you have the GI version, we can give you IV fluids. We can give you a medicine called Zofran, which is a nausea medicine, which is a great medicine because kids can take it, adults can take it. It's relatively inexpensive. It comes in little tablets that goes under your tongue. So you don't even need to swallow pills. It just dissolves under your tongue, and it makes you better much faster. And of course, prevention is the most important thing. So prevention being washing your hands, big one, flu shots. People tend to rely on the hand sanitizer, but that doesn't kill a lot of bacterial or viral infections. So really, if you have the option, wash your hands. Don't rely on the hand sanitizer so much.
And you brought the IV to show us.
I did. At Chesapeake ERgent Care, we're one of the few urgent cares that actually can provide IV fluids. I wanted to show your viewers because a lot of people are scared of IVs. So this is what an IV actually looks like. I don't know if you can get a shot of that, but it's a plastic catheter with a little tiny needle on the end. You can see how small that needle is. It goes into your skin, and then the needle is withdrawn, and all that's left is this little plastic catheter. And then all the fluid drips in through this. And you can put this bag of fluid into somebody in probably 30 to 45 minutes.
Okay, it kind of helps with some dehydration. And
yeah, it makes you feel much better.
Okay.
Much better.
And we talked about a little bit people, when to stay home from work, when to keep your kids home from school if they're starting to exhibit some of these symptoms.
So if you feel badly, if you have a fever, I wouldn't go to school or work. If you are nauseated and throwing up, I wouldn't go to school or work or having diarrhea. And then the rule of thumb is after your last fever, give yourself 24 hours before you go back.
Okay. It seems common sense, but a lot of people maybe think, oh, you know, I can make it.
Yes.
But
yes.
with it being so contagious and everything.
It's so contagious. So I just wanted to mention a couple other treatment options or prevention options. So we talked about hand hygiene, which is so important. Wash your hands at all times. I'm a parent. I have 3 little kids. You know, we all want to send our kids with a healthy lunch to school, and baby carrots are perfect because they're small, they're crunchy, they're healthy. But the problem is they're hand food.
Sure.
So you want to avoid hand food because God knows what you just touched before you eat your food, and flu virus can live on surfaces for a long time. So it could be someone sneezed on the table the day before, it's still there, you touch it, you grab your carrot, you eat it, now you're going to get the flu.
Okay.
So try to avoid sending your kids to school with hand foods if you can.
Good tips. Thank you for being with us, Ron
Thank you so much.
ERgent Care. Thank you. We appreciate it.
Thank you.